Capsular pattern refers to a characteristic pattern of loss of passive range of motion in a joint that is associated with joint capsule pathology. In the shoulder joint, the capsular pattern dictates that motion restrictions occur first in the external rotation, then in abduction, and third in the internal rotation. In the early stages of capsular restriction, you may only see limitations to the external rotation. Acromioclavicular joint capsular pattern refers to pain at the extreme range of movement, especially in relation to horizontal adduction and full elevation of the arm. Pattern of sternoclavicular joint describes pain at extreme range of movement, especially during horizontal adduction and full elevation of the arm. The capsular pattern at the elbow is characterized by limitation of flexion and extension, where flexion is usually being more limited than extension. In the radiohumeral joint, capsular pattern is characterized by decrease in elbow flexion, forearm supination, elbow extension, and pronation.
The capsular pattern of the proximal radio-ulnar joint is defined and limited by pronation and supination. The capsular pattern of the distal radio-ulnar joint is full range of motion with pain at extreme rotation, that is supination and pronation. The capsular pattern of the wrist is characterized by equal limitation of flexion and extension. The capsular pattern of the metacarpopharyngeal joint is flexion and extension. The capsular pattern of the interphalangeal joint is flexion and extension. The capsular pattern of the trapeziometacarpal joint is characterized by abduction, most limited, followed by extension. The resting position is midway between abduction and adduction, and midway between flexion and extension.
Capsular pattern of hip is characterized by gross limitation of flexion and slight limitation of extension. Also, there is limitation of medial rotation with little or no limitation of lateral rotation. There is also slight gross limitation of abduction. Normal capsular pattern of knee joint is gross limitation of flexion and slight limitation of extension. The gross capsular pattern of tibiofibular joint is being described as the pain felt when the joint is being at stress.
Capsular pattern of talocrural joint is plantar flexion and dorsiflexion. Capsular pattern of first MTP joint is extension and flexion, while second to fifth MTP joint capsular pattern is variable. IP joint capsular pattern is flexion and extension. At mid-tarsal level, capsular pattern is dorsiflexion, plantar flexion, adduction, and medial rotation.
Temporomandibular joint. The capsular pattern has been described as opening, protrusion, and lateral deviation. This pattern limits both active and passive mouth opening, with passive opening being more restricted than active. More severe restriction of lateral flexion and rotation is often followed by more tolerable restriction of extension and flexion. Hence, a person with cervical capsular pattern will have some trouble looking up and down, as well as rotating their head to the sides and tilting it to their shoulders. Then comes the thoracic spine, which consists of 12 vertebrae. The greater restriction on rotation and extension, along with mild restriction on flexion and lateral flexion. In other words, a person with a thoracic capsular pattern will find it challenging to twist their trunk and bend backward, but they may also find it challenging to bend forward and to the sides. And last, lumbar spine. A more severe restriction on flexion is often followed by more modest restriction on rotation and lateral flexion. Thus, the individual who has a lumbar capsular pattern will find it challenging to bend forward, but they may also find it challenging to twist their trunk and bend to the sides. Thank you.